Hey everyone, I'm Dr. Divya, and during my NEET preparation, I had collected some really important histology slides that are frequently asked in NEET PG exams, also in the FMGE exams. So, in today's video, I'll just go through some of the really important slides, and now without wasting your time, let's dive into it. The first one is about cerebellum. So cerebellum has got three layers. The first one is molecular, second one is Purkinje layer, and third one is granular layer. So molecular layer is pinkish and it has got stellate cells and basket cells. Purkinje layer is having, I'll just zoom it in. This glass-shaped cell is known as Purkinje cell, which is also known as Purkinje cell layer. Third one is granular layer, which has got Golgi cells and granule cells, right? You can remember it as GGG, right? Granular layer is having Golgi cells and granule cells. Okay, and this is a zoomed out view of cerebellum. The pinkish one is molecular layer, then the second layer is Purkinje layer, third one is granular layer. And one thing to remember in cerebellum is, this is frequently asked, all the cells in the cerebellum are inhibitory except granule cells, which are excitatory type of cells, right? Next one is about bone marrow. So as we all know, initially the red bone marrow will be generating all the hematopoietic stem cells, but as we age it will be replaced by fat, so it becomes a yellow bone marrow. So up to 20 to 25 years the red bone marrow will be functioning. The examples of red bone marrow, these are important. The first one is the vertebral bones, then you have cranial bones, clavicle, ribs, sternum and pelvis. So these are found in the central part of the body. You can easily remember the examples of red bone marrow in this manner, right? Then one thing to note is the osteoprogenitor cells will further form the osteoblast. So basically osteoblast cells are made from the osteoprogenitor cells. Okay. Then histological preparation of bone sections is done using a acid, that is EDTA or citrate, in order to decalcify the bone. Then about osteoid. So osteoid is basically, it is unmineralized organic matrix of the bone. I'll just zoom it in. So this pinkish thing is osteoid, which is mainly made up of type 1 collagen and some gelatinous matrix. And this type 1 collagen is secreted by osteoblasts. Okay, and this is a histological section of the bone. So the unit of the bone is known as osteon. Wow, unit of bone is osteon, which is also called as Haversian system, which consists of central Haversian canal surrounded by lacunae. In that lacunae, you will find this osteocytes, right? This is a better image. And these two Haversian canals are connected with the help of another canal, which is known as Volkmann's canal. Remember, two Haversian canals are connected with the help of Volkmann's canal. Okay. Then this is some basic thing about the formation of the bone. So there are three types of bones, right? Membranous, cartilaginous, and membrocartilaginous bones. So membranous bones are formed from the mesenchyme. The examples of membranous bones are easy to remember. Just the skull and the facial bones are examples of membranous bones. Then the second one is cartilaginous bones. The name itself suggests that these bones ossify from hyaline cartilage. Examples of these are the bones of the limbs, vertebral column, and thoracic cage. And rest of the bones are formed from both partly from the cartilage and partly from the mesenchymal condensation. These are known as membranocartilaginous bones. You just need to remember the examples of membranous bones and cartilaginous bones. Then comes sebaceous gland. Sebaceous gland is this is important, and sebaceous gland is an example for holocrine gland. How to identify it from the section is, I'll just zoom it in. It's a bit lighter and it has got some pinkish material in it. So that is how you can remember that it is a sebaceous gland. And surrounding that, you'll also find erector pili muscle, right? You should also remember the examples of other glands like apocrine gland and merocrine gland. The easy way to remember is, for example, Apo stands for, remember it as Apollo hospitals. So Apollo hospitals are special hospitals, right? So apocrine glands are specialized glands. For example, mammary glands and cereminous glands, which are found in the ear canal. So in that way you can remember. And salivary glands are example for merocrine gland. Then comes the difference between serous acini and mucinous acini. So serous acini is, these are like, I have drawn it here. These are triangular cells which are having zymogen granules, darkly stained, and this is important. The example for serous acini is a parotid gland, right? Then comes mucinous acini. These are tall cells with flat nucleus at the base, which the name itself suggests that it contains mucoid material. An example for mucous acini is a sublingual gland. Right. The example sublingual gland and submandibular glands, these are actually example of mixed salivary glands, but serous glands, the example for serous gland is parotid gland, that you should remember. And this is a histological section of serous acini, and this is histological section of mucinous acini. These are kind of a bit paler when compared to serous acini, right? Now comes the histological section of the muscle. The functional unit of muscle, as we know, it is sarcomere, right? And sarcomere is a segment between two Z lines. These dark lines which you are seeing here is Z line, and this unit between two Z lines, this unit is known as sarcomere. And in the middle of the sarcomere there is a line. that is M line. So you can remember M for middle, M for M line, and this zone is H zone. And these light bands, which you're seeing it here, is I band, which basically contains overlapped actin filament. A band is the one which contains the myosin filament. Remember that A band will always remain constant during contraction of the muscle, whereas I band and H zone will contract, or it will shorten during the contraction of the muscle, right? H and I zone will shorten during the contraction, whereas A will remain always constant. Then comes a skeletal muscle. Skeletal muscle, you can identify it by seeing some of the features. Like, one thing is it is parallel. There are no branches in skeletal muscle, so it is unbranched, right? And you can see that the nuclei, these are found in the periphery, and they are flat, kind of flat, right? These are the features of skeletal muscle histological section. Right? Then comes cardiac muscle. So how to differentiate it from skeletal muscle is, first thing you should remember, the key feature is intercalated disc. Basically, it is this dark line which you are seeing it here is intercalated disc, which is found only in the cardiac muscle, right? So this intercalated disc is basically, I'll just brief about intercalated disc. This is basically Z line of cardiac muscle, which is made up of again the gap junction, the fascia adherens, and desmosomes. Gap junction is the one which functions as syncytium, which helps the muscle to contract, which helps the muscle to basically the cardiac muscles, all the cardiac muscles, they will function as a single muscle because of the presence of this gap junction, right? Also, the second point is they are branched, right? They are branched here, so I'll just show it here. You can see some of the branching here, right? The cardiac muscles are branched, and the nuclei is centrally placed. This in the center, it is oval in shape, right? These are the features of cardiac muscle. The most important thing you should remember is intercalated disc, right? Then coming about cartilage, there is a famous mnemonic for the type of collagen found in cartilage. Read it as cartilage. So cartilage is having type 2 collagen, right? Basically, there are two types of cartilage. First one is non-articular, the second one is articular. Non-articular because it is having perichondrium, and articular kind of cartilage, the perichondrium is absent in articular kind of cartilage, right? There are, broadly speaking, there are three types of cartilage: hyaline, fibrocartilage, and elastic cartilage. Hyaline cartilage, how to identify is the chondrocytes here, they are found in lacunae, and they are found in the group, right? So they are found in clusters. So these are known as cell nests. So I'll just zoom it in. So they are found in the chondrocytes are found in groups or clusters. So this is how you can identify hyaline cartilage. The second one is fibrocartilage. It is very easy to identify because here the chondrocytes are squeezed in between the fibers. So the chondrocytes are found in row, right? They are found in row. And one more thing, a distinct point about fibrocartilage is having type 1 collagen more than type 2. So F for fibrocartilage and F for first. So fibrocartilage is having type 1 collagen more than type 2. Examples of fibrocartilage is all the central part of the body, like you have intervertebral disc, the pubic symphysis. Menisci, it is an important question. Menisci does contain fibrocartilage, and articular disc of TMJ joint. So this is also a question where the articular disc of TMJ joint is an extension of lateral pterygoid disc. You should remember it. Another distinct feature of fibrocartilage is it doesn't have any perichondrium. Okay, so important features of fibrocartilage: type 1 collagen, doesn't have perichondrium. The examples, all the central part of the body, mostly the central part of the body, and they are found in row. The chondrocytes are found in row. Then comes elastic cartilage. Elastic cartilage has got type 2 collagen, and it has perichondrium also. How to differentiate it from hyaline cartilage is you should look at the chondrocytes. The chondrocytes are not found in clusters. They are found separately, single. They are all single, right? So chondrocytes, there are no cell nests, and that is how you can identify it as elastic cartilage. One more thing is sometimes they can give you the silver stain elastic cartilage, and mostly silver stain is done for elastic fibers, right? So in that way also you can identify if the section is brownish color or blackish color, it is usually elastic cartilage. Then you should remember the examples of elastic cartilage, which is easy to remember: E for elastic and E for epiglottis. So epiglottis is having elastic cartilage, E for eustachian tube, which is having elastic cartilage, external ear, and nasal septum. So remember, most of the things from starting from E, they have the elastic cartilage: epiglottis, eustachian tube, external